Hello, I'm Trevor Van Schooneveld. I'm the UNMC ID Fellowship Program Director. Thank you for your interest in our program. I'm going to provide here a brief overview of our program and how it's structured. Hopefully I can give you a good picture of how we run our things and what's important to us. I would encourage you at the time of the interview to ask lots of questions if there's anything you don't understand or would like more information, because we really want you to have a great picture of how we run things. This is a picture of our campus looking east towards downtown Omaha. I'm really disappointed you can't come and visit us here at UNMC in Omaha because I found they're really fantastic places to live and work. But again, hopefully in this presentation, you're going to get a real feel for how our program works, and then through the interview process, learn about what it's really like to work here. What I want to cover in this discussion is, first, I just want to go over the goals of our program. I think it's important for fellows to know what the goals of the program are that they're attending, so they know what we're going to try and accomplish. I'm going to talk about our inpatient and outpatient clinical experiences. I'm going to talk about our didactic program, how we go about research, and then hit a couple things on special things towards the end. As I mentioned, I'm the program director and have been the program director since the fellowship started. A couple years ago, we added Dr. Zimmer as an associate program director, and she's been super helpful and wonderful to work with. Dr. Rupp is our division chief, and he's been very involved in the program since its start. I think it's helpful for fellows to understand the goal of the program, because this is what we're going to try to accomplish while you're here. And, the short version of my goal as a program director is that you guys as fellows are ready to go out and practice in whatever position you're interested in and do that very successfully. And so we want to prepare you for that. And we know different fellows have different trajectories of where they want to go. And we want to have a great program that's going to prepare you, but have some flexibility as well, because we know different people have different goals. And so our primary goal is to prepare people to practice ID in the 21st century. And that means, first, you have to be clinically proficient in diagnosing and managing both common and uncommon infectious diseases. And if you come here, I'm confident you will become proficient in managing infectious diseases. We see lots of typical bread and butter stuff, but we also have strong institutional programs and advanced forms of surgery, oncology, including lots of bone marrow transplant, all forms of solid organ transplant you could think of, big critical care and trauma programs. And so our fellows get exposed to the patients that are treated with those therapies and their complications. And so there really is a great diversity of patient experience here. And that's really the foundation of the program, is learning to be a good clinician. Second thing is, we think research skills are important, and so we want our fellows to learn how to review the literature, generate a hypothesis, investigate it, interpret their data, and then present their data. And so we have some structured ways we go about research. We think this is important even for fellows who aren't going to participate in research after they're done with their fellowship, because it will make them better physicians and will make them better able to interpret the literature. Next, we want to give our fellows some real-world experience in some unique areas: infection control, stewardship, biopreparedness. And I'll talk a little more about these at the end. But these are opportunities I think that fellows have in the workplace to really expand their negotiating power, to generate revenue without just doing clinical work. And they're really good ways for fellows, for ID physicians, to become involved in hospital leadership. And frankly, they're just areas of need. And so we want our fellows to be prepared to meet those needs. Finally, we want our fellows to be proficient in leading multidisciplinary teams. And so they're going to do that in the clinic. They're going to do that in the hospital. And it's just a skill we have to have these days if we're going to practice medicine in the 21st century. So those are our goals. That's what we want to accomplish in the 2 years you're here. Next, I want to spend some time talking about our inpatient infectious disease services. We have 5 inpatient infectious disease services that the fellows will rotate on. They'll spend the most time on general ID, and then about 6 months on solid organ oncology, 1 month each year on orthopedic ID. They'll do 1 month of community ID, and then, as I mentioned, about 4 to 5 months of general ID total. So you get a good clinical experience on these services. And each service is very different. And so I'll just talk a little bit about how they run. The general ID service is probably what you think of as a general ID service. There's an attending, a fellow, 3 to 4 residents, typically a couple of students, some pharmacists. And so it's a rather large team, and it's all of the typical general ID stuff you'd expect. Ventilator-associated pneumonia, ICU complications, endocarditis, meningitis, just a variety of general ID. It's really the bread and butter of ID. And our fellows get lots of experiencing patients there, become very skilled at managing the problems they encounter there. It's really the foundation, I think, of our training of ID fellows. Our fellows will spend 1 month each year on orthopedic ID. This is prosthetic joint infections, complicated spines, basically anything the orthopedic surgeons are working on, that's who you're seeing. On that service, we have ID faculty who have expertise in orthopedic infectious disease, and that's what they do in their clinics. That's what they do as service time, and so they get trained by those people. We have a dedicated solid organ transplant service and a dedicated oncology service, and these are two separate services. The transplant service has organ transplant patients, and those were listed, and some of our advanced cardiac device patients. The oncology service is all of our oncologic problems, bone marrow transplant, surgical oncology, general oncology, etc. And so those services, you get about 6 months between those two services. And again, they're staffed by faculty who have often done extra training in transplant ID or have worked in immunocompromised ID for many years. And so we have faculty who really are experts in those areas. Finally, we added on a community ID rotation. This is something new that fellows will do a month of during their 2-year fellowship. The goal was to give them a little different setting to practice it. On this rotation, you go to a small community-based hospital, which is a much more private practice type setting, and then a long-term acute care hospital. There it's a lot of one fellow with one faculty, and so you get a lot of one-on-one time. It's much more independent and private practice model. And we wanted our fellows to get some exposure to that because we know some of them are going to end up in that model. We want them to know what it's going to look like. Also, the long-term acute care hospital is a unique set of patients that you have to longitudinally manage. And so we wanted fellows also to have that experience. And so that's our inpatient experience. Through that, I would say our fellows feel exceedingly comfortable in managing most infectious problems they're going to encounter. One other thing I should mention about those services is on our transplant and oncology and orthopedic ID service, there are some dedicated didactic sessions. There's also a dedicated didactic session on the general session we do on general ID that our fellows participate in as well. And so we try to add some didactic components to that to beef up the training when people are on there. So it's not all just clinical work. Next, I want to talk about our ambulatory outpatient experience. The center point of this is our HIV clinic. Our HIV clinic is a very large clinic that manages over 1,000 HIV patients. It's a multidisciplinary clinic that includes ancillary services, psychiatry, addiction, medicine, pharmacy, nursing, social work, etc. It's really a one-stop shop for people with HIV. Our fellows spend half a day per week in the HIV clinic for their whole 2 years. The reason we do this for 2 years is, one, it takes a while to learn how to manage HIV. The medications are complicated. Understanding how to manage the disease is a bit complicated. And the second reason is we really want fellows to have a longitudinal experience of managing patients over time, of developing patient relationships and having people see them as, actually, that's my HIV doctor. And you just can't accomplish that using short blocks. That's the way we've approached it. We also have a general ID clinic, which fellows will participate in during their first year. That's sort of every couple of 3 months. You do it when you're not on general ID. It's a half day per week. In that general ID clinic, it's all non-HIV. And so it's FUO and hospital follow-ups and how is that endocarditis patient doing or that complicated spinal infection doing? What do I need to do for follow-up? And I think that's also a great learning experience because you learn how to manage these patients once they get out of the hospital as well. And then finally, we have an outpatient rotation that fellows do during their second year where we catch a bunch of the stuff we haven't caught anywhere else. things like viral hepatitis. We have a mycobacteria clinic, dermatology, wound care, travel medicine, some of the subspecialty ID clinics. There's just a variety of experiences, and it's a bit customized to what fellows want to do. Some of the things they have to do, like viral hepatitis, STD, mycobacteria, but other things it's sort of, well, what are you interested in? What do you want to cover? And so that's the ambulatory experience for fellows. Our didactic program includes a variety of lectures and journal clubs. We have once a week what I would consider our core curriculum. Now, every other week that's HIV, and then in the off weeks it's core curriculum, which is all the non-HIV stuff. And so our HIV roundtable occurs twice a month, and this is a really fantastic teaching session that our HIV faculty run. It involves not only our fellows, but the Creighton University fellows and the pediatric ID fellows who are in town. In this, they do a bunch of the teaching. It's very interactive, and the fellows do some of the teaching. And our fellows really enjoy it and really learn a lot about HIV management. On the off weeks from HIV, there's core curriculum, and that's sort of your typical, let's talk about endocarditis, let's talk about meningitis, let's talk about antibiotic resistance, those topics. We have a citywide ID case conference that happens every Thursday morning that rotates to different cities, different hospitals in the city each week. And so the first week it's out at a private hospital. The second week it's at Bergen, which is the Creighton site. The third week it's at our institution, and the fourth week it's at the VA. When it's at our institution, our fellows present cases, and it's a typical case conference. You learn a lot at it. We then have some divisional conferences. We have a research conference, which is a divisional conference. At this, various faculty present once a month their research, what they've done, what they're doing, how they're doing it. And then at the end of their second year, our fellows present. And so April, May, June is fellows presenting their research. We give you till the end of second year so you can get your research done to present. We have 2 journal clubs. We have a general ID journal club, and then we have an infection control stewardship specific journal club. Each one meets once a month, and fellows get the opportunity to present at those, as do faculty. And then finally, we added, based on fellow feedback, a board review lecture. And it's not really a lecture. What we do is we send the fellows a bunch of board review questions. They review them, look up the answers, and then sit down with the faculty and just say, hey, what do you think the answer is here? And why do you think it? And then we talk through the question. What are the key differentiating points how you can sort out what the answer is? How do you look at the foils? And even if you don't know the answer, how do you try and get it narrowed down? And just help them to think through the questions, but also it helps us to cover some topics that we may not see or are very unusual. Research is an important component of our program, and fellows will spend about 6 months on research during their 2-year fellowship. We want this time to be meaningful, and we want them to accomplish a lot. We don't want you to have the experience I had when I did research, where it came to my research month and I showed up and my program coordinator said, there's where you can work. You can get to work. And I said, but what am I supposed to do? Was not a very good structure to the research program. And so we want to have some structure, but we also want to have some freedom and some flexibility for you to do research in areas that you think are interesting. And so the first step to this is after you get here in the early fall, we will set up meetings for fellows with various groups of physicians, be it the stewardship group, the infection control group, the transplant group, the oncology group, all the different groups, to sort of just hear what opportunities and projects are out there. What's available? What could I do? What could I be doing? And the goal is for them to really see the scope and breadth of opportunity and then to figure out what they want to do. Hopefully they'll have some idea of here's the research project I'd like to do in this area because I'm interested in maybe doing transplant. And so I want to work with Dr. Florescu on this transplant project, et cetera, et cetera. Then what we do is we actually have a research committee. And the goal of the research committee is to give you feedback and to make sure we've set up mentorship, because we've really got to have a mentor to help you direct your research. That's what makes research successful, is working with people who've successfully done research in the past and can help you to accomplish the same thing. And so at the research committee, which will typically happen in November-ish, we just ask fellows to come in and tell us what they want to do and who do they want to do with, and we kind of talk through it. And there's 3 or 4 of us, and we basically say, that idea sounds great. Here's a couple of suggestions. Tweak it. You're going to work with Dr. Florescu. Go for it. Or you might say, boy, those 2 projects you suggested, project 1 is going to require 5 years and $500,000, and so we don't think that's a very good project for you to do as a fellow, just not accomplishable during fellowship. And so maybe project number 2 is a better option. Or maybe you could do this little piece of project number 1. And the goal is really just to make your time fruitful and successful so that you can present your work at meetings. And frankly, my goal as a program director, and this is in line with what ACGME says, is you need to have one good project that you can write up and publish. One good one. A lot of our fellows get more than one done, but the goal is at least one. To help you do that, we also have one other component. There's a clinical research symposium that our institution puts on, and it's a week-long interactive didactic program really designed for fellows. And it's all about how to do research. How do you write an IRB? What are the requirements of consent? How do you do statistical analysis? What does mentorship look like? What you should look for? How do you write study aims? All those sort of key things that you don't really learn anywhere in like medical school or your internal medicine training, but are really important if you're going to do research. And so we want our fellows to be supported and successful in their research. Finally, I want to talk a little bit about some of the additional activities our fellows participate in. There are others, but these are a couple ones that I want to highlight. We have a dedicated infection control antimicrobial stewardship rotation. As I mentioned, I think these are skills that all fellows need to have. I think they make fellows very marketable. I think they're going to help fellows be successful in the environment we now work in. And so I think we just all have to know this kind of stuff now. The infection control stewardship rotation, you basically learn how does the infection control department work? What the heck do they do? How do they make their decisions? How do they operate? There's a whole behind the scenes thing that they do that most people have no idea that they're doing it. How do they keep us compliant with all the regulations and keep the doors open? And then for antimicrobial stewardship, we want our fellows to be well versed in what does that mean to do antimicrobial stewardship? How does that work? How do you go about it? So the foundation of being a good steward, though, is being a good clinician, but stewardship has a slightly different view. It's a little more of a population view than an individual patient view. And so our fellows get a lot of opportunity to work with their ID pharmacists and ID physicians who do stewardship to understand how we do it. They get to do a lot of the audit and feedback with us. That's what we spend a lot of time doing, reviewing patients, calling people, giving them input on how to manage antibiotics. The second thing is we have a number of faculty members who are nationally and internationally recognized experts in biocontainment, biopreparedness, managing these really bad pathogens, things like Ebola. We have the country's largest quarantine unit and the country's largest biocontainment unit. And we've managed a number of patients in these, Ebola, coronavirus, etc. And so we developed a didactic, interactive, practical experience component in the second year that our fellows will do, where they go spend about 3 days getting lectures on highly infectious pathogens, understanding how units like this work, how you would manage, how you do containment, and then doing some PPE drills for the advanced PPE you might wear for Ebola, and then doing some drills with our biocontainment unit, because we do lots of drills to make sure they're prepared to do their work. And so it's really some practical experience. Everybody seems to be interested in this now with coronavirus, but our faculty really have been doing this for many years and are well known. And so we want our fellows to work with them and get experience doing this with them. And then finally, conferences. I do want to talk a little bit about conferences. During fellowship year 1, we send our fellows to ID Week. We think it's a great experience. They always love going and come back energized and excited about ID. In the second year, we'll send our fellows to a conference as long as they submit something. It could be a scientific abstract, could be a case, doesn't have to be accepted, but we do expect them to submit something if they're going to go to a conference in the second year. Typically, this is ID week, although if our fellow wanted to go to Shea or Microbe or something like that, depending on their interest in their career, I'd be supportive of that, but we'll support a conference in the second year as well. And our fellows have really enjoyed those experiences, and let's have a couple pictures of some of our faculty, fellows, students at these conferences. So with that, that's the overview of our program. Hopefully you've learned a lot. Please ask us lots of questions. If there's something that is unclear, please review the website. If anything is not clear or you have other questions, I would be happy to answer them. Thank you, and we look forward to meeting you soon.